What is cold water shock for children? Have you ever jumped into a cold pool and felt that sudden chill? For children, this can be more than just a surprise. Cold water shock is the body's quick and involuntary response when someone suddenly enters cold water, especially when the temperature is 15 degrees Celsius or lower. This reaction can be particularly risky for children because their smaller size and developing bodies can make them more susceptible to its effects. When a child suddenly finds themselves in cold water, their skin temperature drops rapidly. This triggers a reflex known as the cold shock response. The child may gasp for air uncontrollably, breathe rapidly, and experience a sudden increase in heart rate and blood pressure. These reactions can lead to a loss of control over breathing, which raises the risk of inhaling water and potentially drowning. Additionally, cold water shock can cause muscle weakness and affect coordination, making it harder for the child to swim or stay afloat. Cold water shock happens in stages. The first phase lasts about 2 to 3 minutes and includes rapid cooling of the skin and changes in heart and breathing rates. If a child stays in cold water beyond this initial phase, they face further dangers, including hypothermia, which is when the body temperature drops to dangerously low levels, loss of consciousness, and heart problems. Unlike hypothermia, which builds up over time, cold water shock can incapacitate a child in just a few minutes. This makes it a serious concern for water safety and injury prevention. Children may not fully understand or react appropriately to the symptoms of cold water shock, so supervision is crucial. To keep children safe, it is important to avoid sudden immersion in cold water. Wearing appropriate flotation devices can also help. Teaching children how to float to live is a valuable skill. This involves tilting the head back, keeping the ears submerged, and staying calm while waiting for the shock to pass before trying to swim or call for help. In summary, cold water shock is a rapid and involuntary reaction to sudden immersion in cold water that can cause breathing difficulties, heart stress, and loss of motor control. For children, this response poses a significant risk of drowning. Therefore, it is essential to prioritize preventive care and education to ensure water safety. Always consult healthcare professionals for personalized advice and guidance regarding water safety for children.